I like to ask people like you, smart people on my show, if you had one piece of advice to give to these company owners, the CFOs, to help them thrive in the new economy. I have a feeling I might know what you're going to say, but what would you tell them to do that in this next generation where you've got to watch your margins unlike any time before? Yeah. What should you do?
I will tell you unequivocally, healthcare is the largest business blind spot in American businesses today. Warren Buffett called it a tapeworm on American business. So I just want you to think of it as reframing what healthcare for the last 30 years has basically represented a confiscatory tax, not only on the business, but on every working American. It's the number one reason that we have wage stagnation in the United States. The cost of healthcare outside of higher education has consumed the vast majority of wage increases for working Americans. So people are literally making less money than they did 5 years ago because it costs so much more for healthcare at their company. So what I would tell CEOs and CFOs is that you need to get involved. So there's a difference between being informed and involved. When you're informed, yeah, you sit in a meeting 1 hour a year and your team comes in who you pay to manage healthcare, and they tell you, here's what we've done, and this is what we're doing. We do all these best practices, and they check the box on off everything, and they go, okay, is this the best we can do? Yes, and we beat our peer benchmarks. But you lost money. You spend $100 million in the healthcare budget, and you lost $5 million. You're at a 5% margin. That's $100 million of new sales you have to make next year just to break even on the healthcare budget you lost. That's $5 million less that you have for wage increases next year. And so because your costs went up, you had to increase the amount of contributions you charge your employees, and that ate up the 3% pay increase you gave them. This cycle has gone on for a decade. Being informed doesn't control anything. CFOs need to get involved. They need to apply rules like zero-based budgeting that they've done for 30 years on the finance side and apply that to the healthcare budget. There should be no reason to have any increases in their healthcare budget. I don't care if they spend $5 million a year or $500 million a year. Great story. $500 million healthcare budget. Multi-billion-dollar global publicly traded company. I'm with the treasurer, the senior VP of finance, and the CFO. Big chalkboard. They still had a chalkboard. $500 million I read on the board. They had no idea who their healthcare consultant was. $500 million operating line item, and they don't know who they pay to give advice on that because they weren't involved. So this is just an example of the point I'm trying to make. What would I tell C-suites? Get involved.
Not just informed. I love it. Now there's going to be a lot of people watching this who say, I got to talk to that guy. Craig, how do they reach you?
Yeah, you reach us by going online, Catilize Health, C-A-T-I-L-I-Z-E, Catilize Health.
That's great, Craig. Thanks so much for joining us.
My pleasure, Nick. Good to see you.
We'll be right back.